What's up, YouTube? It's Josh, FJ55 Iron Pig. Thank you, as always, for clicking on that video. You're right along with me. Today is May the 2nd, 2015. Yes, sir. Yes, sir. And it's 12:45 in the afternoon. I'm on call. I haven't been too present in YouTube lately because, let's see, a couple weeks ago, my wife had to have surgery, not emergency surgery or anything, but her shoulder. It's called a SLAP surgery, S-L-A-P. I forget what the acronym stands for, a lot of Latin in that. But it's also called a quarterback injury. Basically, it's where your bicep and or your tendon, is it your rotator cuff, your labrum, that's the softer tissue that surrounds the cup inside your shoulder on the inner body part, not on the arm part, gets damaged somehow. What happened to her is about the labrum is a circle that surrounds on the inside of your shoulder here, and about 180 degrees of that, almost half, was torn. She had damage to her bicep, damage to her tendons as well. Well, after a few doctor's visits, she got hooked up with one of the best orthopedic surgeons here in Arkansas. In fact, he's the orthopedic surgeon for, just realized I have my AC on, it's probably kind of loud, sorry. He's the orthopedic surgeon for the ASU Athletics. ASU stands for Arkansas State University. They are the Red Wolves. Arkansas State, or just state of Arkansas, what we can call it, is the Razorbacks. So, she had surgery. So she had an incision here on the top of the shoulder, back of the shoulder, and underneath her arm, in that sensitive spot. And they had to cut her bicep a little bit, had to adjust this, had to adjust that, had to screw a hole in her shoulder and put a screw in there that her bicep was wrapped around to realign it because it was getting ready to give way. Needless to say, it was a lot of pain. And I've been taking care of her in between working. And still taking care of her, and I'm on call, so a little bit here, a little bit there, just a little bit of everywhere for this guy. But I wanted to talk to you specifically. This is going to be a little bit of a long video, I apologize. I want to talk to you specifically about something that happened the night after she had surgery. It was outpatient surgery. So she has the surgery. I bring her back, is in the next town, about 30 miles away. Bring her back home, and have her all nested up on the couch with a bunch of pillows and everything, and she's all nice and cozy, and she's sleeping and not asleep because of the drugs and stuff and the painkillers and everything else she's on. Well, she suddenly says, man, I've really got to go pee. It hurts, I got to go pee. So we get her up, it takes a little while, and we get her over to the bathroom. By we, I mean her and I. And get her in the bathroom. She does her business and need to change her pants, get her some fresh pants. So I get her some funny pants, as I like to call them. Sweatpants, basically, with little designs on them. Actually, pretty cool ones. They're the, it's a mousse, but it's all brown, chocolate brown, and it says chocolate mousse on it. Got her that years ago. But yeah, she stands up, and I've changed her pants for her. She says, oh, I'm getting really dizzy, I think I'm going to pass out. She says that a few times, and so I said, well, sit back down on the toilet. And she's still saying, oh, I'm so dizzy, I think I'm going to pass out. I'm like, okay, well, if you pass out, it's okay, I got you. Almost got your pants on. And I feel, boom, right onto my shoulder. And, yeah, she passed out. And her head plopped right on my shoulder. And I'm glad I was right there to hold her for that, because, sitting on a toilet and passing out may not be the best idea to do. So I'm like, oh, great, how long is she going to be passed out for? Hopefully it's just a few seconds, 10, 15 seconds, no big deal, right? Well, she's just a normal passed out person, breathing normally, and then her breaths get far and fewer in between. What I mean by that is there's longer pauses in between breaths. It gets to the point where it's almost, well, it seemed like it was forever, of course, in a situation like that, but probably close to between 5 and 10 seconds in between breaths. So try it yourself. Inhale. Exhale, that's about 10 seconds, give or take a second. And that's roughly, on the average, how much she was in between her breaths. So that alone was kind of odd. But then she stops breathing. And just the moment before she stopped breathing, her pupils dilated fully, and they locked over to the right. And they wouldn't move, almost like she was having a stroke. And I say her name pretty loud. Nothing, no response, nothing at all. I hadn't noticed she hadn't stopped breathing yet. I noticed the eyes. And so I tap her on the face and say, hey, and I yell really loud. Telling her to respond to me, hello, are you in there? Say hi, do something, move. Can you move your eyes? And that's when she stops breathing that I noticed, because her lips started turning kind of white and bluish, and her skin started, just like if you couldn't breathe. If you ever seen someone who was suffocating, that's what it looked like. Open her mouth, check her airway, it's completely clear. By the way, I'm not trying to be a cool guy with the hat. I have it backwards, it's got my work information on it, you don't need that. But yeah, she stopped breathing. So I'm like, shit, I have a hold of her right here. I go to grab my cell phone immediately. It's not in my pocket, like I always have it. Why? Because I was just showing her mother-in-law, or my mother-in-law, her mom, not an hour earlier or so, how to use the Chromecast. And she was over at her house. And I'd left it on the coffee table in the living room, which was just 20 feet away or so. Well, maybe more, 30 feet away. So I get her down to the floor in the living room, carried her over there real quick, because our bathroom is really small, there's no room at all. Get her out there, and I start to perform rescue breathing. She still had a pulse, a good pulse, so her heart didn't stop. And yeah, she still wasn't breathing. And it seemed like an eternity trying to get her into the living room. It really did. It probably wasn't even 5-10 seconds. Probably. I really don't know how long it took me. But it felt like it took forever. And get the phone out, get on speaker, or yell at my phone, call 911. No, you can do that with your phone. If you have an iPhone, you have Siri, you could give it voice commands if you have it enabled. I use it a lot for work, for sending text messages while I'm driving. Text messages while my hands are full. Tell it to call people, tell it to call work if I have a question, if I can't use my hands. Came in handy. I highly recommend you turn that function on your phone. All you have to do is tap that home button twice. Bloop. Comes up. Call 911. Bloop. Calls 911. Just like that. Yeah. So the moment the phone connects, 911, what's your emergency? She starts breathing on her own. Thankfully, she starts breathing on her own. And I start telling the operator exactly what's going on. And we live probably 3 blocks away from the hospital. It's a good hospital. And they're there 45 seconds, a minute later maybe. Beautiful. I mean, you can't ask for a better response time than that. Honestly, you cannot. They come in, they check her out, and she's not lucid, which means she's not very cognizant, not aware of what's going on around her too much, because she's been without oxygen for a little while. And the painkillers and everything else has been going on that day. And they check her out. All her vitals are fine. Perfectly fine vitals. Nothing wrong. Of course, she refused to go to the hospital, which is fine. I mean, hospitals are scary places in the sense that people are misdiagnosed and killed there every day. I don't blame her for not doing that. But, yeah, whatever with that. But, yeah. Watched her like a hawk all that night and all that morning. Didn't sleep. I was worried. And still coming to terms with it. Pretty much every day still hits me that I almost lost my wife. Now, my wife is not just someone, I meet a lot of people, oh, it's just my wife, that's my 3rd wife, that's my 4th wife, whatever. My wife really is probably my best friend. We get along really well. And in that moment, I really thought I was losing my wife. I thought she was just about ready to die right there in my arms. And there wasn't a goddamn thing I could have done about it. Hopefully CPR would keep her alive long enough to get emergency services there. But the reason why I bring this up is, you know, like what Skinny Medic says. I don't know if you ever watch Skinny Medic's videos on YouTube. He's got really good videos. He's a medic. And his catchphrase is, you never know when you'll be the first responder. And in that situation, I was the first responder. I mean, literally. Right there. You are the doctor, the medic, the paramedic, the nurse. You're everything, because you have to be as good as you can. What would I have done if I hadn't had medical training, if I didn't have common sense, but if I didn't have any medical training whatsoever? Even just basic CPR class teaches you a lot. And those of you that live by yourself, you have no family, no one around you at all, take the class anyways, because it'd be good for you. It teaches you how to give yourself the Heimlich, which can save your life. A lot of people choke because they chomp on too big of a piece of food and it gets lodged in their throat. Knowing how to give yourself the Heimlich could save your life. But if you have a family, if you have loved ones, especially if you have children too, the Red Cross has a free CPR class. Not only do you learn cardiopulmonary resuscitation, CPR, I myself am trained to use AEDs, which is basically, the shocker you have in the hospital. There's portable ones, so I'm trained on that as well. And plus all the training I had in the military, in the Navy, which, believe it or not, the Navy has a really good medical training for just the average person. But yeah, it still hits me like a ton of bricks. To be honest, I still cry over it a little bit. It brings tears to my eyes just thinking about it. And it scared the shit out of me. It really did. And it made me think, keep my damn phone on me all the time. Most of us sleep with the phone right next to us. We have it in our pocket throughout most of the day. When I go to the shower, sometimes I take it in the bathroom with me. Sometimes I leave it over in my room. I have my little man cave room. But yeah, it just reiterated, what if she needed me to perform CPR? Actual full chest compressions and breathing. If everything shut down on her, I would have to stop what I'm doing, leave her, go to the living room. Hopefully I'm not so freaked out I can't find my phone or remember where I left it. Go to the living room, off the coffee table, grab it, and come back. A lot can happen in that short amount of time. A lot of brain activity can be lost because they're not breathing in that short amount of time, and they can never get it back. It's gone. Once it's gone, poof, it's gone forever. That part of the brain dies from lack of oxygen. Now, if I had it on me, yes, I'd have to stop and pull it out of my pants and set it down on the floor or the sink or the toilet or wherever I could. But that would take 3 seconds versus 10, 15, 20, 30 seconds. Keep your phone charged as much as you can as well. Whenever you have opportunity, charge that puppy up. How much does a phone battery cost, a replacement one, for those of you that don't have iPhones? Mine's $20 if I want to go get it replaced. If you charge it, and you get to the exceeded cycles of charge and discharge, and the battery's no longer good, just go buy another damn battery, dude. Yeah. Alright, I'm off my soapbox. Thank you for watching. She's doing great. She had no more episodes of passing out or anything like that. But just like Skinny Medic says, you never know when you're going to be the first responder. Go get some training. A lot of training you can do online, but it really helps to be hands-on and have someone, an instructor there, showing you exactly what you're doing wrong and what you're doing right and how to correct the things you're doing wrong, so that you are not normal, you are outstanding, you're above normal. So that if you are the first responder, whether it's a family member or an accident on the road, you can effectively help someone, even if that someone is you. You. Thanks for watching, guys. You have a good day, and please be safe out there. Bye.